I'm Dr. Anna Tichenor. I'm an assistant professor at Indiana University School of Optometry, and I'm presenting on a poster looking at treatment response patterns in patients who have been treated with lifitegrast who have dry eye disease. Some of the key findings that we found with this study, one is that there is a general trend of some patients that will respond very early on when being treated with lifitegrast, and they're going to start to show some early symptom relief as early as 2 weeks. And most importantly, they're going to start to show a really robust relief of their symptoms as well. Greater than 60% reduction in their visual analog scale for eye dryness, which is really, really important. Another thing that we found with this analysis of the data was that lifitegrast can also provide multi-symptom relief. So not just alleviating dryness in our patients, but also alleviating symptoms of foreign body sensation, burning, stinging, and pain is also very, very important also for our patients in order to get that kind of multi-symptom relief with dry eye disease. So dry eye is a multifactorial condition, so there's lots of factors that lead to its development and pathogenesis. So as clinicians, we do our best in trying to select the appropriate treatment that's going to be most successful for our patients, but having some kind of guidance in terms of selecting patients that might be most likely to respond to a particular treatment would be super impactful and helpful to know ahead of time so that we can get patients going on the right treatment that's going to give them early symptom relief. So while we didn't really find any kind of distinguishing characteristics in patients who may have kind of that more robust response, when you treat patients with lifitegrast, we did find that 3/4 of those patients, so 75% of patients treated with lifitegrast, are going to see a pretty robust response in reducing their dry eye symptoms, anywhere from 2 weeks up to an 84-day kind of time point. So many of our dry eye patients have many symptoms associated with dry eye disease. So with lifitegrast, what we see from this data is that you're able to get that sort of all-encompassing, more encompassing relief of symptoms, and you may even find that, again, the patients that kind of really respond to lifitegrast are going to get an early response of up to 2 weeks, starting to feel relief of symptoms, which is what we all want for our patients. We want them to get relief as soon as possible, and patients want that too. I think another interesting part of this sort of sub-analysis that we did was really trying to tease out, we get a lot of data from clinical trials looking at statistical significance, but is that really clinically meaningful? So this data shows truly you're getting this sort of clinically meaningful response with lifitegrast and improving symptoms in 75% of patients who are treated with this. And even more than that, 50% of those patients are going to get a really robust 60% reduction in eye dryness symptoms. So it's very clinically meaningful, not just statistically significant.